2 cc pre-roll. See this is a 3 cc syringe. And the dose here is packaged in 2 milligrams in 2 cc's. So 1 milligram per milliliter, right? Makes sense? I'm going somewhere with that. So, and it also comes with an aerolizer deal. So what happens is when you preload preload packages, put this all together, that's 2 cc's or 2 milligrams. You only want to give 1 milligram. So we have this little cliche, it's waste one, give one. Or, so waste one, and then I'm going to give one. And I would give this right into the nostril, right there, like so. I'm just gonna, there you go. So, you guys all want to try that?
Sure.
We'll just have you guys.
So it comes in 2 milligrams. So you want to get rid of one of those
Correct,
milligrams
yeah.
and only administer.
Right.
One.
That's per our protocol. That
Okay.
we're giving 1 milligram versus other agencies might give the full dose. Like some police agencies, they give the 2 milligrams, and 2 milligrams, that's a lot. 1 milligram's a lot. When I give it, it's 0.4 milligrams IV, right? You're giving 1 milligram because it's intranasal, right? So how it's absorbed. So yeah. Any question?
So why do
Does
you
that make
waste
sense?
it?
No, that makes sense.
What's that?
Why do you-
Because you're only supposed to give 1 milligram.
Just
Okay.
for,
Just for
two.
our protocol.
Yeah.
Okay.
And actually, great question. So when we say waste one, it's much easier to waste one, and then give it, right? And I just have to push the syringe to the bottom versus it's
Oh, you're trying to do 1 milligram.
trying to do one and
then not,
save it. Oh yeah, that's actually harder to do than you would think.
Because then you can't get the full
Yeah,
effect.
so if I were to do that and then have to stop, I might think, oh shoot, I just gave too much, right?
So what happens, because we've been on a call where we're arriving and people have already given like 4 doses of Narcan.
Okay. 4 doses, like the public?
Yeah.
Okay.
So they're known opiate users, and so they all
Yeah.
have Narcan on them, and they see their friend,
Right.
unresponsive. They're just
Well, I'm really glad that they called us quickly instead of waiting 40 minutes,
right.
right? I mean, so, but yeah, what was your question then? What do you do?
Does anything really happen to?
No.
They just.
Yes and no.
Right.
Let's talk about, we'll have you guys do that here in a minute. Let's talk
Mhm.
about toxidrome and what can happen. So, Narcan just stops the opiate at the opiate receptors.
Right.
It just takes it away.
The blocker.
Right? The block, it just blocks it, right? So yeah, you can give Narcan all day and it's not gonna hurt the patient, you're just blocking those receptors, okay? Let's talk about opiate, folks. When I show up on an opiate overdose, you guys have checked the pulse, you've got a good airway, pinpoint pupils. Let's say I've got a syringe, or I'm at a nursing home and they've got their Percocet bottle. I've got a toxidrome. It's the use, pinpoint pupils, and they're breathing less than 8. You've seen them on the nod, and obviously you're a police officer, you know that. Anybody know what the nod is? It's when they're sitting there like this, and you wake them up. Hey, you, what's going on? Oh yeah, that's right, you guys are here. We had a lady one day at a hotel in Shoreline, and she was skin popping the opiates, and she was conscious alert talking to me. And I said, you know what? Stand up and let's walk to the rig. And we just walked her down to the rig, sat her on the stretcher, and on the way to Northwest, she started to do this because it hadn't taken effect yet, right? We deal with it. So we get to the scene. What I always do is I always check skin. If I have warm, dry, pink skin, what does that tell me about an opiate overdose? Warm, dry, pink. Recent. Love that. Yes, I love recent overdose because they haven't been down very long, right? They haven't been down long enough where rhabdo starts to take effect, where the muscle starts to break down, and now it's in the bloodstream. Kind of like excited delirium. You see those pictures where the person on meth, they're all amped up, they're making animal noises, the lid lift, you've probably seen them. They're running around naked, right? And when they start to calm down, I actually really don't even like going on these calls because when I hear, like, they were all over the place and now they're calming down, I'm thinking, get them in our rig, quick. Yeah, because they're dying is
Yeah.
what's happening. The rhabdo's kicking in, right? Anyway, interesting thing with opiate overdoses. If I have cool, pale, clammy skin, not a good sign. They've been down too long. What can happen is if we give Narcan, this is why you guys have to be real careful with giving it. Be aware that they can wake up and have what we call flash pulmonary edema. You ever seen it?
No, I don't think
So it's white. But what happens is, I'll try to explain it real simple, as simple as I can, but it makes sense. Picture your body, you stop breathing, or you slow way down. What happens in your body? Everything starts to settle, right? Just everything's, and all of a sudden you take away, with the Narcan, you take away the opiate effect. The body now tries to breathe. Picture, I try to breathe, my body's trying to wake up, and it's basically sucking the fluid into the lungs. You can imagine kind of this vacuum, if you will. So now, instead of,
does that sound like, so we had someone that sounded like they need like their like CPAP machine. Is it that? kind of
Yeah.
sound? Okay, so I've been on a call like that.
Yes.
And he was just, it was really weird.
yes.
It just sounded like he was like, had like a really deep snore.
Oh, well, after the Narcan?
Yeah.
And was he frothy?
So he was like a very like palish color,
Oh, yeah.
and then just having that really weird sounding breathing.
Yeah.
And so my partner was like, oh, I think he's just, and he had a CPAP machine,
Yeah.
and so oh, he's just, but he was sweaty. It was weird.
Yeah.
And so we just called it. So
Did you get us coming?
Yeah.
Awesome.
100%.
Well, did you put the CPAP machine on?
No.
Oh, okay. I just-
There was bottles, and then looking shower scan where there's needles, and
Yeah.
we were like,
Um,
is it that sound?
it's the gurgly sound,
Yeah,
because
yeah.
his lungs are filling up.
Yeah.
And so that's why my little editorial. Sometimes we all want to play doctor, and I appreciate people wanting to treat themselves. The druggies that are, I get it. But two things about folks giving Narcan that concern me. I'm doing it right now. I'm warning you guys, just giving you the thought what can happen. Either their buddies, I'm glad they call 911, because I can picture this. Oh, Jack, he just took too much of his opiates. I'm going to give him some Narcan, and I'm going to wait an hour. Well, now his buddy's dead, right? Or they give it, and they go into that flash pulmonary edema. And basically what that is, like I said, it draws all the fluid into the lungs. They wake up, and it's just spewing. And it's tube time. It's get a BVM out, let's get a cannula on them, let's bag them up, and we're gonna intubate them. And I've been on a couple of those just in the last couple of years, it happens every once in a while. And it was just like that. Came in as a cardiac arrest. It's no shock advised. Now they have a pulse. I feel the skin down a long time. Watch for it, and okay, tube time, right?
Yeah.
That's not exciting.
No, but that's exactly what he sounded
That,
like.
yeah. So anyway.
And he was a large
Yes.
man.
Well, this is what's really cool though about Narcan. Speaking of large, we had a very large young man, 250-ish pounds, laying in a bedroom between a bed and the wall. He's laying there, 2 o'clock in the morning, and we're all kind of surrounding him. And it really is kind of funny when I put my glasses on and I look at the chief. Chief, can you confirm my drugs? And he's doing the same thing. Because we can't read the numbers anymore, right? I mean, because they're so small. Anyway, but my partner said, Coolidge, we're going to wake him up and he's going to walk out of here. Fair enough. And he walked out of there after we gave him the Narcan. So it could be a really cool drug. I want to warn you too, a lot of these people wake up and they're not nice.
Mm-hmm.
You've ruined their high, you've just botched their day, right? And they can come up swinging. What I do, and I want you guys to remember this, when they wake up, say, okay, sir, good. George, I'm glad you're awake. We're the fire department, you overdosed. Don't fight us, don't hit us. I want you to cooperate, do you understand? You do your cop talk, right?
Yeah.
I mean, that's what you gotta do. It's not rude, you're not being domineering, you're just taking control of the scene. We're not messing with you today, basically. But when they come up with then it's all bets off, we better too, right?
Yeah.
But these folks would be very violent. Because we might also be taking away they might be speedballing too. right?
Right.
So now they're all amped up.
And physiologically, how does narcan work again?
Right, so the opiate receptors, you take an opiate, and now you get pinpoint pupils, decreased respiratory drive, right? It takes the pain away, basically, it's a pain med. What Narcan does is it blocks it. It blocks the opiate receptor, so now the cells aren't getting that.
And that's immediate?
Well, pretty quick, yeah, within a minute or so.
And then it can wear off though.
Yes,
So
that's the other thing,
Yeah.
yeah.
How long?
That's, 15, 20 minutes. I'm gonna just throw a couple numbers out there, but, and that's why with these folks, well, I don't wanna go. Yes, you're going.
yeah.
Officer, would you please tell them they're going?
And
Because,
they will still say no. Well, it's
Okay.
alright, you're gonna drop.
and I'm not into being mean and rude, but
So you tell them
sometimes I'll
they're
tell
gonna-
them,
well,
you might die, right?
And they'll sign the waiver,
Yeah.
fine.
It was interesting. I gotta share this other story. Sorry. This one guy, though, it's amazing how backwards they are, if you will, or backwards to us. I'll explain. You know how we're like, oh my gosh, I almost died? I hear that all the time. Yeah, you weren't breathing, but we got you back. Oh, I didn't know that could do. Yes, maybe you better get some help. Let's get you to the hospital. This other guy, one morning, we woke him up and he goes, did I almost die? Yeah, you did. And he's like, wow, I guess I didn't take a strong enough drug. I mean, that was, I'm thinking, he was so addicted that he had no, hope or reason to live. I mean, it was very sad. So anyway, we take good care of him. All that. Questions?
Actually, a question on the flash pulmonary edema. Is that why you're supposed to ABM them before giving them Narcan?
No,
Okay.
no, that's a great question though. You know what, no, you're bagging them because of the respiratory drive, because they're getting hypoxic.
Right.
And that's why I put VVM down here, right? Because really what's cool about this, when I hear opiate overdose and I walk in and I go, how are they bagging? Great, what's the blood pressure? What's the sugar? What's the lung sounds? They're all clear, the pinpoint pupils, Mike. All right, want to spec me a bag? I'll drop some Narcan and wake them up and it's a done deal. What you're doing is you're actually preventing them from going down too far. I mean, so the quicker you can bag them up, the less likely they'll go into flash pulmonary edema, right? So,
You're creating that pressure to keep the fluids out, or?
at the point before the Narcan, all you're doing is ventilating them. But my point there is, if you didn't ventilate them for a time, they're going to get so low that when we do wake them up, they're going to go into flash pulmonary edema. Does that
Okay,
make
yeah.
sense? I mean, good sats at 98%, Mike. They're looking good. We wake them up.